And I'm going to go ahead and whoops, share my screen with you. Whoops. Always forget how to do this more efficiently. So it always takes me a minute to figure it out. All right. Okay, so everyone should be able to see my screen. If you can't for some reason see my screen, let me know. Um, but this is part two in our series of Healthy Gut, Happy Life, because the gut is such an integral part of our entire system, and that's what we're going to be talking about today. So last week we talked about just how the whole digestive system works. And today we're going to get a little bit more in detail about how things go wrong. So the first thing we'll do is talk about how to recognize in your own body when things are out of balance. I'm going to talk a little bit about diagnoses. Like some people come to me with already having been diagnosed with IBS, IBD, ulcerative colitis, that sort of stuff. What those names tell us and what they don't. And we're going to spend a fair amount of time talking about other body symptoms. So, not directly in the gut, but how other symptoms in our body, other things on lab tests might indicate a root gut imbalance. And then we'll talk about some testing options to get a little bit more fine grained about what is happening and treatment options. So, how to know when your digestion is less than optimal? When I see new patients, we always talk about gut stuff. And so many times people say, oh, my digestion's fine. And I've never found that to be the case. Um, so at the bottom of the slide, there are some things that are common. These are in the gut thing, inside the gut directly. Common things: diarrhea, constipation, gas, bloating, burping, and then, of course, because today is all about what goes wrong, we're going to talk about poop. I found this in a research article and I thought it was really, really interesting. 60 to 75%, depending which study you look at, of Americans suffer with digestive discomfort, including heartburn, reflux, constipation, diarrhea, gas, and bloating. That's a huge, huge number. And I would warrant a guess that it's closer to 75%, just given my small slice of patients that I see. So we're going to start inside the gut. That first slide that talked about, some of the common things: constipation, diarrhea, all that stuff that's very directly gut related. We're going to talk about some of those signs and symptoms and what they tell us about what's going on in the gut. So these are some common things that I hear people talk about, or sometimes they don't even think that this is abnormal, but these are things, the cues in my mind when I'm talking to people that tell me, something might be out of balance. So if you can't poop in the morning without coffee or caffeine, there's probably something a little amiss. Food just feels heavy in the stomach after eating, feels like things aren't digesting, things are moving slowly. Any runny, loose, urgent stools, of course, diarrhea. Constipation is a huge one, and we're going to talk more in depth about that in a moment. Any excessive burping or gas after meals, either immediately or within an hour after eating. Any kind of abdominal bloating, and bloating is so common, and there are lots of types of bloating, and each variety of bloating can tell us something different about what might be causing it. And then heartburn or reflux, which are really the same thing, but I put them both there because people have different ideas about what those words mean, and we're going to talk a little bit about that too. So we're coming up on the poop slides. This is also something I talk about: bowel movements with everybody. I want people to take a look, take a peek after you go to the bathroom. This is such a direct window into our digestive system of how well it's working or not working. Are there parasites or not? I know it's a gross topic and no one likes to talk about it, But the more people come back and see me, they just know it's going to be a regular part of the conversation and get used to it over time. And it's invaluable. It's free, no testing required, and it really does change over time. And it tells us whether or not the treatment is working. So this is the infamous Bristol stool chart, developed in Bristol, England, their claim to fame. And I often find that people have a really hard time describing, you say, what does your stool look like? And they can't give you it's normal. That's what everyone says. So this just gives people a really simple, easy thing. They actually make this in giant laminated posters you can put up in your office. I don't have one, but if someone wants to get me a Christmas present, it'd be great to have. You really want things to be around the type 3 or 4, but this gives clear pictures and also descriptions of the basic different types. And things can be variable and change amongst these. But if you really don't know how to describe something, just take a look at this chart. So constipation deserves a few minutes of its own time because that word means something different to a lot of different people. Just like heartburn and reflux can mean different things to different people, constipation can mean that you simply skip days. There are days when you just don't have a bowel movement, or 2 or 3. Sometimes severely chronic constipated people will go 3, 4, 5 days without having a bowel movement. Constipation can mean that it's hard and difficult to pass stool. It can also be soft, but still difficult, feeling like you have to work to get it out, or it takes a really long time. Simply feeling incomplete, like it's just not finished, or you sit there and you wait, and then it feels like maybe later something wants to come out, but it doesn't. And then one that I added in, and we'll get to why this is important later in the talk, but if someone has, they're like, oh yeah, I go right away in the morning or maybe after my coffee, but then I feel like I have to go another hour later and then again an hour later. And that process can happen 2, 3, 4 times in the morning. And then in the afternoon, nothing. So it's what I call spastic constipation, where the body's clearly trying to get something out. And those stools can be loose or hard or well-formed or any myriad of things. But the keynote being really that it's spastic. The body's trying to get something out and it's just not doing it in one fell swoop. All those things count as constipated. So then we're going to talk a little bit about other symptoms, and this is the big portion. So clearly that was not a definitive overview of all the things that can go wrong in the gut, but those are just some of the very common over-the-top symptoms that people talk about. And before we move on to this one, actually, I want to say a little something about heartburn and reflux. I didn't put in a slide about this, but people often think, well, heartburn, it has the word burn in it, right? So I have to feel the burning in my chest or in my throat. And that reflux indicates that you're actually like almost regurgitating or something's coming up, like you can feel that acid rise into the back of your throat. Those are true, but heartburn can also be silent, where the only thing people feel is a slight pressure in their chest, or the space right at, right between where your ribs come together, where your stomach actually lies. Sometimes there's a warm or burning sensation there, or it feels heavy, or that feeling like food doesn't digest. It's just sitting right there in the stomach between the rib cage. And maybe sometimes it's just a sense of pressure in the chest and difficulty breathing that gets diagnosed as asthma. And that's because any little bit of acid that gets into the esophagus can trigger the vagus nerve. The vagus nerve, which we're going to look at again today, innervates all the organ systems in the body, but it can send, if it gets irritated by acid, it can send a false message to the lungs that there's something irritating there, and it'll cause the lungs to constrict. And the common symptom of that is people will feel this frothy cough. They'll feel like they have to cough, and they just get this frothy mucus in their throat. That's often heartburn. Tends to come on at night or when people lay down, and often gets misdiagnosed as asthma. Constant sore throat, feeling like just your throat or your vocal cords are irritated. That can be silent heartburn if you're not feeling the actual burn or regurgitation of food or anything. It could be happening while you sleep and you just don't notice it, but it's causing irritation in all the tissues. Possibly esophagitis, just irritation of the whole esophagus. So really heartburn's kind of the common term, and gastroesophageal reflux disease is the more specific term, GERD or reflux, but really they all refer to the same kind of mechanism. They just point to slightly different symptom experiences, I guess. And However you experience any of those, however you might experience heartburn silently or not, to me, heartburn is a sign of deeper imbalance. It's often not, it doesn't come alone. In very rare instances have I seen heartburn be the only piece of the puzzle. It's at the top of the system. So if it's out of balance, there's typically something down below that's also out of balance. So now these are other body symptoms that get overlooked because people think, well, I don't have diarrhea or I'm not constipated, so my gut's probably fine, right? Well, maybe, maybe not. One thing that can be incredibly impacted by any kind of imbalance in the gut are hormones. And I think we have all women on tonight, and the majority of my practice is women. My boss, Dr. Brent, sees a lot of women for infertility and hormone issues. And whenever I see thyroid dysfunction, adrenal dysfunction, any of that, I always look to the gut, especially if it's been going a long time, particularly infertility. And when we get into the reasons why, we'll talk a little bit more about that. But hormones are greatly, greatly affected for a couple of reasons. The main one being that anything in the gut that's out of balance is going to throw your good microbes out of whack, and you're not going to digest things well. You're going to be nutrient depleted. Your body won't have the raw materials it needs to make hormones. Hormones require quite a bit of effort to build, and the body is usually so depleted that it's going to use those nutrients for other kind of more higher importance daily functioning. So hormones kind of get left out. And a lot of this gets confused with peri and postmenopause, and you can also have gut dysfunction and peri and postmenopause going on at the same time, and the gut dysfunction will aggravate it. So some hormonal signs and symptoms, and these are probably going to sound very familiar to a lot of you. Insomnia, huge, any kind of insomnia, difficulty falling asleep, difficulty staying asleep, feeling tired when you wake up in the morning. Elevated blood sugar, and to me that means anything over 90 consistently, or elevated hemoglobin A1C over time. Even if you eat, especially if you eat a very good diet and don't eat a lot of sugar, but you're still seeing elevated blood sugar or borderline elevated, good sign of gut imbalance. Night sweats, thyroid dysfunction, low or high, although I'd say low more commonly. Adrenal dysfunction, again, overactive or under. Any kind of menstrual irregularities, so short cycles, long cycles, heavy bleeding, pain, ovarian cysts, fibroids, endometriosis, you name it. Any sort of female hormonal irregularity. And then, like I mentioned, infertility, especially when there's been full fertility workup and eggs look good, sperm looks good. There's no known reason, which is super common, as some of you probably know, in the fertility world. I would always, always look to the gut. This, again, is not an exhaustive list, but these are just sort of the common things that I see. So then the next big category of things that can go wrong is neurotransmitters. I'm sure many of you know that the gut is called our second brain. Huge portions, up to 90% of serotonin is made in the gut, as well as dopamine and GABA. And those neurotransmitters do a lot to regulate our digestion, as well as have mood effects that we all know about. They help us to sleep, to relax, to feel happy, all of those things. So when the gut is out of balance, we're going to be depleted in all of these hormones, or neurotransmitters, sorry. And so we know that the gut-brain connection is well established. And we talked a little bit about the vagus nerve last week. This is just another cool image that shows that wandering yellow nerve, how it goes up into the head. It doesn't show the top of the head in this image, but it does wind all the way up into the brain, all the way down the esophagus, around the heart, and then twist its way through all the organs in the digestive system. So it's just tangled and intermingled with the entire system, sending information back and forth constantly, 24 hours a day. And 90% of the fibers in the vagus nerve send information to the gut, or to the brain from the gut, not the other way around. So if we look at it this way, the digestive system here, the gut, and all of the microbes are sending constant information back to the brain. 90% of those fibers are telling the brain what's going on in the rest of the body. by monitoring the digestive system and all the organs. And then the brain makes decisions based on that information. So whatever's coming from the gut is going to affect the motility of our digestive system. Typically will slow things down, but can also speed things up and lead to that urgent diarrhea or alternating constipation and diarrhea. It's going to affect the secretion, particularly of hydrochloric acid, which leads to heartburn and reflux. And as we talked about last week, that just sort of throws the entire digestive cascade off. It can increase secretion of things, but typically it's going to decrease because that's what slows down digestion. And then it's also going to impair the nutrient, I would say, absorption and delivery, and it's going to affect the microbial balance. All of those good bugs that we want there are going to be thrown off when that message to the brain is constantly saying that there's stress or inflammation or whatever it is that's out of balance in the gut. If it's sending those messages back to the brain is then going to perpetuate those same issues. So with all of these symptoms that we feel, diarrhea, constipation, bloating, abdominal pain, cramping, hormonal and neurotransmitter imbalances, we sometimes, depending who you are, a lot of people have been to lots of different doctors and they might come to me already having been diagnosed with a variety of different things. And people want to know, okay, well, I've been told I have IBS with, mixed with constipation and diarrhea. What can you do about that? Well, we're not treating the condition per se, we're treating you as an individual, but it can give us some information. So diagnoses in general is a name that we've somewhat arbitrarily given to a collection of signs and symptoms. So people have a certain pattern of symptoms, and we've decided as a medical community to give those symptoms a name, mostly for convention so that it's easy to recognize right away. Okay, someone has IBS mixed. I know what that means right away. I know a little bit about their symptoms. So it does tell us what tissues and parts of the body are involved and to what extent. For example, ulcerative colitis, you know that there are ulcers, that there's more extensive tissue damage in UC than there is in IBS or IBD. So it can be helpful from that perspective. The downside, and it can lead you or it can lead me as an alternative practitioner to other tests that might be necessary to run. The downside of having names or diagnoses for these collection of symptoms is they're often not that simplistic. So, for example, someone with IBS mixed might have, they only have one bowel movement every 3 days and then they have diarrhea for 3 days. Or they might have bowel movements every day, but they're really small, or they have that spastic type of constipation. But the diagnosis doesn't tell us that. All it tells us is that sometimes they're constipated and sometimes they have diarrhea. What we really want to know, or what I really want to know, and what makes treatment more effective and efficient is the exact details of that person's symptom picture. So, and the other downside for patients is that when people have struggled with these issues for a long, long time, they can start to live their diagnosis and it can become a story. They'll start to say, my IBS or my Crohn's disease or my Lyme disease or whatever it is. It becomes a self-perpetuating story. And so I try to get people to look at their symptoms as part of their whole body. That's why we're talking about bodily symptoms, not just gut symptoms. And that it's your body's wisdom creating these symptoms so that you can tell me what's happening and we can investigate what's really causing those symptoms. And that's why we want to ask not what, but why. So we don't care necessarily that it's IBS or Crohn's or it's useful, but we don't care all that much. What we want to know is why. We always want to ask why. Why is the body creating these particular symptoms that we've named IBS or IBD? That's where we're going to get the answers of how to fix it. This is just another cool quote. The human intestinal microbiota comprising bacteria, viruses, fungi, multicellular parasites, and archaea represents one of the most complicated ecosystems on Earth. And I can attest to that. It is incredibly complicated, individually variable, changing over time, responsive to everything in our lives, what we eat, how much stress we're under, the things that we're exposed to. It's incredibly complicated, but also beautiful like a symphony. And when it's working well, it's amazing. just the things that our digestive system does for us. So the major players, and these are the normal human microbiota, are H. pylori. It is normal in some people and does not cause problems. It tends to be carried in families, so a lot of times everyone in the family will have it with no symptoms. All kinds of bacteria, good, bad, and probably a ton we don't know about. Viruses, archaea, yeast and fungus, and parasites. So the balance between all of these is really the key, and we're going to talk about each one a little bit individually. So, and the pictures on each of these slides are pictures of the actual organism. Um, so Helicobacter pylori, or H. pylori, is opportunistic. So like I said, it can be normal, but it will overgrow when the opportunity arises. That's really what opportunistic means. If the um, terrain in your body is such that it allows H. pylori to proliferate, it will, because it can. It runs in families. It can be normal. You can have heartburn or not, heartburn and reflux or not with H. pylori. H. pylori is associated with ulcers, but again, you can have even elevated levels of H. pylori found on stool tests and not have any of those upper GI symptoms. So when I see that especially, it makes me think that the true imbalance is something lower down, and that the H. pylori is just a symptom of a deeper imbalance. We are going to talk about treating each of these as we get to the end, but we're going to kind of go through them first. So this pretty little yellow fuzzy guy is Pseudomonas, which is one of my favorite gram-negative bacteria, if one can have a favorite bacteria. Again, opportunistic. It can be present. Some people believe that it shouldn't be in the human body. Other people say maybe it's part of our flora. I think it really depends on the person. It is a gram-negative, which means it does not have a cell wall, and they are harder to kill. And when I see a stool test, for example, with a lot of gram-negatives, that often gives me the sense that there's some other stuff going on as well, probably yeast and parasites as well. They tend to come together. But the classic overgrowth of bacteria in the gut happens at the very end of the small intestine, right as it turns into the large, on the right side of your body, down by your appendix. And we call that SIBO, small intestinal bacterial overgrowth. This is not a new diagnosis. It was actually discovered and the name coined in the 40s. It's just come back into our vision and popularity in the last decade. And I do a lot of SIBO treatment, although these days I rarely see SIBO alone. It tends to be accompanied by a lot of other bugs. But the classic notes of bacterial overgrowth in the small intestine are evening bloating, or bloating that gets worse as the day goes on. So things seem pretty normal. When you wake up in the morning, your belly's flat, and then as you eat and the day progresses, gets bigger and bigger and bigger. And people will say they feel 5 months pregnant by the end of the day, but there's no gas or burping associated, or if there is, there's very little, and it doesn't do much to alleviate the bloating, and the bloating can be extremely painful. So that's very classic SIBO. The things that tend to bother bacterial overgrowth, and it could be all of these or just a couple, are grains of any kind of carbohydrates, fruit, and alcohol. And often in the person's history, if these are the symptoms, there's some history of food poisoning. It might even be mild. They might have just been nauseous. You don't necessarily have to have traveled anywhere to get this. And possibly a history of a lot of antibiotic use. And I would actually say that is for all of these almost. If there's a history of excessive antibiotic use, even if it was in childhood and the person's 50 years old when they come to see you, that is part of what kicked all of this off at some point in the past. So archaea are really interesting little creatures. This picture is, I don't know the species, but it's part of the Methanobacteriaceae, which are tested for on most of the comprehensive stool tests these days. We don't know a lot about them. They're ancient single-celled organisms. They're not truly bacteria. They're not viruses. They're really kind of in their own category. We don't separate them out on tests into species typically because we just don't know that much about them. They're just grouped. On most tests, it'll just say Methanobacteriaceae. Sometimes there will be some sub-listings under that. And there can be natural genetic variation. So one example of that is certain people with West African ancestry often make more, just naturally, they have more methane producing Methanobacteriaceae in their gut. And part of the reason that scientists think that is that these bacteria are really good at getting nutrients out of nutrient poor foods. So people who come from their heritage is from peoples who existed on things like cassava root or any kind of starchy root like that that's pretty poor in nutrients tend to have more of these in their gut. So it's not always pathological. It could just be a genetic variability. But what we do know is, at least with SIBO, if methane producers are high, there's often constipation involved. Not always, because again, some of this can be normal for somebody, and you have to take that into account. But it is often seen more with constipation. These guys are tough to kill. Nobody really knows how you do it. To me, in my experience, they tend to be in that same category as gram negatives. They're tougher to kill, but it can be done. And really, you want to just improve the balance overall, and that'll help put these guys back in their place. And then yeast and fungi. So this is Candida as well as other types of fungus. So Candida albicans is the one that we talk most about. It's the one that's been studied most. It's the one that we tend to have as a normal part of our bacterial flora. But there are other species of Candida, and then there are also other types of fungus. And some of the stool tests out there do test for different varieties. Mold mycotoxins are also a type of fungus and can coexist with Candida. Not mold spores. Mold spores can only go as far as your sinuses. They're too large to get into the gut itself or into the bloodstream. But the mycotoxins can lodge in the gut with yeast, and they clump together and they stick together and they can aggravate the problem. A lot of constipation with chronic yeast overgrowth. It can be diarrhea or loose stools if it's more acute, but in my experience, it's more associated with constipation. In this case, you get a lot of morning bloating. So the bloating is kind of consistent. It might get worse with carbohydrate-rich foods, especially processed carbs like pasta and stuff. But people will wake up feeling full, even if they haven't eaten for 10 or 12 hours. Stools can be floating and kind of fall apart. There's usually a lot of gas, or at least more so, associated with yeast. And a big one is alcohol intolerance. So people who over time they say, I just can't drink anymore. It makes me feel terrible. I have the tiniest bit of wine and I get all kinds of symptoms, but primarily I feel super hungover, or it goes to my head right away. I feel like I'm just not metabolizing it. That is a sure sign of yeast overgrowth or fungus or some combination. And then just a brief side note about molds and mycotoxins, because this is the thing that everyone's talking about these days, and it is a big thing. When you have one of these things in your body, it makes you more susceptible to the others. And like I said, they can coexist with yeast. All of these things can overgrow and perpetuate each other. But the big thing about mold is it's almost always, if you've got high mycotoxins, from some environmental exposure. Yes, there are foods that contain mold and mycotoxins, but that will add to the burden, but it's often not high enough to create a massive amount of mycotoxins in the body. There's always an environmental exposure, whether it's your house or your workplace. So that's where you look first. And that's the biggest way to get rid of mold, is you have to eliminate the exposure, because mold, if you're constantly breathing it in, you're constantly filling your sinuses with mold spores. And every time you breathe, the air passes over those mold spores. They get a little irritated, and their response to that is to release more mycotoxins that then can get into your bloodstream and into your brain and into your gut. So there are other ways of treating mold and getting it out of the gut and getting it out of the body. But the number one thing you need to do is figure out where the exposure is coming from and get rid of it. And that's a whole other talk unto itself, but I'll just leave it at that for tonight. And then parasites. This is one of my very favorite topics because I think they get overlooked. They're very, very common, much more common than we think they are. In the US, if you just do a little search, every US organization will tell you that parasitic infection is not common in Americans, and I can tell you that that is completely false. Parasites include everything from microscopic protozoa, which is what this picture is. Oh, and I forgot the picture on the Candida slide is of Candida, just FYI. This little purple and gold pretty thing is Blastocystis hominis, which scientists used to believe was a normal part of our flora. And I think there's still debate about whether or not that's true, that some people can have it just like they have H. pylori and not have symptoms. Other people who are really into parasite treatment will tell you that any protozoa, blastocystis or otherwise, can clump and create aggregates just like yeast, and it can cause a lot of low-level chronic inflammation in the small intestine, and it needs to be eradicated. Um, Parasites require treatment. Diet is never enough. They are tenacious, they are sticky, they hide behind biofilms, so they really, really need to be treated. They're hard to find on testing, and we'll talk about this a little bit in the testing section. As with yeast, yeast and parasites are both pretty hard to find on stool tests, so it comes down to clinical diagnosis based on your history and symptoms. Some of the common symptoms with parasites that differentiate them, and this is not always 100% true, but they tend to cause more pain, cramping, all kinds of bloating, but I would say a little bit more like yeast bloating. SIBO bloating is just so classic and unique for SIBO that um, it's easy to differentiate. This bloating can come and go. There's often a sense of fullness when eating. Can't eat a lot. Meals have to be pretty small. And there's often something cyclical in nature about the pain. So maybe it's once a month, right around menstrual cycles, or commonly around the full moon. Parasites are more active during the full moon. So things will come and go, but it does tend to be a little bit more painful depending on the parasite. Blastocystis often does not fall into this category. In an acute situation, like you picked up parasites in India, you would have diarrhea more commonly, but chronic parasites, and parasites can live in the body indefinitely, tends to be constipation, and it can be fairly severe constipation because the toxins released by parasites can actually paralyze the nerve conduction in the small intestine and just completely prevent motility altogether. So this can be some of the worst, most obstinate constipation I've ever seen. And then the two biggest extra body symptoms I see are hormone effects and sleep. Um, Parasites create, among other things, they mess with how our body processes estrogen. Typically, if there's used estrogen, it gets bound to bile and pulled out of the body because the body doesn't need it. But when there are parasites present, that binding to bile, that bond can be broken, and the estrogen will be recycled back into the liver in a non-active form that can still interact with other areas in the body and mess with how our body processes estrogen. So we can look estrogen dominant, which a lot of women have that as well, and progesterone can be normal or low, and that is sometimes due to parasites or other gut imbalance. And then insomnia of all kinds, difficulty falling asleep, restless sleep, night sweats, waking up at regular intervals throughout the night, and again, cyclical sleep problems that happen once a month or around the full moon or every 2 weeks or some kind of cycle, because all parasites have life cycles where they're more active and less active. We could do a whole presentation on parasites, but we'll stop for now. So this was a statistic I pulled off of the internet, and I think this is a low estimate. 35% of the world population, not just the United States, has intestinal parasites. I would warrant a guess that it's probably a lot higher than that. So based on everything that we've just gone over, all the different kinds of symptoms that someone could have, almost anything could be a gut imbalance, right? That's kind of what I'm getting at, trying to show you how all kinds of imbalances and symptoms all over the body can indicate some sort of intestinal gut imbalance. So let's say you have some constellation of these symptoms. Now what do you do? Or what have you already had done and where do you go next? So this is a very brief, not complete. There are other things, but this is kind of the process that I go through when I see patients. do I have a gut imbalance, first of all? Well, all that previous information was sort of to give you an idea of whether or not you might, and you can answer that question for yourself. So gut symptoms first, and then whole body symptoms as well. Are they present either acutely, meaning is it pretty new, like these symptoms just came up since you got back from Africa? Or is this kind of a chronic come and go kind of picture? Either one of those questions, if it's yes, then you go on to the testing part. And we're going to talk here specifically about comprehensive stool testing and or parasite tests. Often those need to be done separately. And then really choosing the test that is based on your individual symptom picture. So the tests all have some pros and some cons, and I try to pick the one that fits the patient best, depending what I think might be going on. And then, so then you find that out, and you figure out what the imbalance is. So what do you do with it? So start with the gut first, the symptoms you actually have in the gut, and treat that, but don't forget about the whole person. Remember that gut imbalance affects the entire body, so we don't want to forget about those symptoms as well. If someone has really bad insomnia, but we find that they've got yeast overgrowth, we still want to support them having better sleep while we correct the imbalance that's causing that insomnia. So you always want to take care of the symptoms, and I want everyone to feel better a little bit along the way. You don't want people to feel terrible. And cleansing will come into this picture. So these are the common tests, and I just listed them here because people always ask me this. There's a new test on the market called Biome FX from Microbiome Labs. They make Megaspore probiotics, among other things. It is the most sensitive and specific test on the market, and it's cheaper than some of the others. It does not test for as many yeast or parasite species, but they use the entire genome in their DNA PCR testing. So they look at they're comparing your sample and using the entire known genome, for example, of Candida albicans. The downside is it takes about 5 weeks to get results from these guys. Whereas the other ones like GI-MAP, GI-FX, and GI360 all use 16-segment DNA PCR testing. So they're using 16-bit segments of the whole genome. So some of those segments can cross over with other things. It's not as specific or sensitive, but I do use GI-MAP a lot because it only takes 5 to 7 days to get results. And I've used it enough that I know how to read them well. And I can get information based on what doesn't show up as well as what does. It does pick up bacteria really well. It's a great one for SIBO. I hardly ever run breath tests anymore because this gives more information. And it doesn't pick up yeast or parasites well at all. If yeast and parasites show up on this test, you are just overloaded with them. And there are reasons for that, but the main reason is that yeast and parasites hide behind biofilms, and they don't often get scraped off the intestines when you're doing a stool sample. So they just don't come out in the sample, and if they're not there, you can't find them on a test. And then GIFX is from Genova, GI360 is from Doctor's Data. These are just kind of big labs that we use. GI-MAP is from Diagnostic Solutions. These last two are also DNA PCR, same as GI-MAP. Similar organisms. They do culture things, so they look at things under the microscope, which the others don't do. And if they see something under the microscope, this is useful for yeast because yeast doesn't often come out in the sample. For DNA testing, there might be small enough amounts you can see it on a microscope, but it won't test positive with a DNA test. So you do get microscopy for yeast. They will culture anything that's abnormal and test it for sensitivity against antibiotics and antimicrobial herbs. And this test also doesn't test for parasites well, but as you'll see in the next slide, I think nothing really tests for parasites well. And these guys take about 3 to 4 weeks to get back. So they're kind of in the middle. And you can see the prices there, they're similar. So parasite testing is really tricky because of their life cycles and because they live behind biofilms. And if you've had a parasite in your gut for 10, 20, 30 years, it's gotten really good at hiding. A standard O&P, which stands for ova and parasites, which is what maybe your general practice doc would run, are completely useless. It's a microscopy test. They're just looking at the sample under a microscope. And they kind of do a couple slides. If they don't see anything, they call it negative. And they're looking for things to actually swim across the slide, which most of what comes out in a stool sample is going to be dead. So these, without question, come back. I've never seen one of these come back positive. They're almost always negative, even with someone who knows they have Giardia. So it's really just not even worth your time doing the stool sample. The parasite lab that I use, if we really haven't found anything and people want to know, is a lab called Wellness Research in Colorado. It's run by a guy named Raphael D'Angelo. He has been doing this for 30 plus years. It's a microscopy test, so he is looking at samples under a microscope, but he has a very, very good eye because he's been looking for this, for 30 years. So he knows the difference between a tapeworm egg and a threadworm egg. And he'll tell you exactly how much of things he sees. If he doesn't see anything, he'll ask for a second and third sample. And if they're all negative, then he'll say, okay, it's a negative test. Most parasite tests are common, many, many false negatives. Parasites ultimately, in my world, come down to clinical diagnosis. We didn't find anything else. The symptom picture fits, the history fits. You treat, and then you see what comes out. So another reason to, every time you go to the bathroom, take a peek, because you would be amazed at the things that come out when you do parasite treatment, which totally grosses people out, but it's also very satisfying when you've had long-standing gut issues and then you can actually see what's been causing it or part of the problem. It's very relaxing on some level. So there are a lot of other tests, because we're talking about other body symptoms that might indicate gut imbalance and might lead you to run a stool test. One of the common ones I use all the time is just standard blood work. So complete blood count, which is a CBC, iron, ferritin, nutrient levels, all that kind of stuff. There are very specific markers on a standard blood work test. And if people are interested in this, we can talk about it after. I can answer questions. But one example is MCV, mean corpuscular volume. It's the size of your red blood cells. If that number is above 90 consistently, that to me says malabsorption. That's my number one simple clue that there's something going on there and we should look a little deeper. There's other things that go along with that. That's kind of one of the classic ones. And then there's all kinds of other things you might look at. Organic acid urine test, mycotoxin urine test, salivary hormone panels for all kinds of different hormones, female hormones, thyroid, adrenal, etc. Lyme and co-infections, which we could do a whole series of talks on. Food allergy panels, I don't typically run these right away, but there are reasons to do it and it can be useful. And then again, start with the gut, but don't forget the rest of the body. So if you figure out what's going on in the gut, you're working on that, but someone's just really fatigued, run a cortisol panel, see what their adrenals look like. You really want to work with someone who is going to look at your symptoms as pieces of a larger whole, not individual parts, because you're not individual parts. All of these symptoms are your body's wisdom pointing to an imbalance. So we've found an imbalance. We've found a place to start. So what about treatment? This is by no means comprehensive, but I wanted to give, people always ask about this part because now I'm sure you're all thinking, oh my God, I have all of these things. What do I do about it? If it's a complex chronic case, I would suggest seeing someone and having them, look over these results with you, but there are things you can do on your own. So I'm going to go over some common treatments and diet protocols for all of these things, just very quickly. So low sugar is going to be on all of these. That's kind of, sugar feeds everything, good and bad. So low to no sugar, depending on what we're treating. No alcohol, low caffeine, low acidic foods in general that tend to irritate the gut. And working on proper stomach acid is going to help. The best treatment for H. pylori is proper stomach acid. When the stomach acid is too low chronically, that's what causes heartburn and reflux, and it allows H. pylori to grow. It lives in the stomach, so clearly it can live in a fairly acidic environment. But if your stomach acid is consistently above 3, it's going to allow this to just grow more and more and more and cause more problems, cause more inflammation. So you want to correct the entire gut imbalance in order to truly get rid of H. pylori, and if reflux and heartburn are present, that's the best way to do it. And then some of the common treatments, there are antibiotics that are specific to H. pylori, but many, many, many of the strains of H. pylori these days are antibiotic resistant. I don't think I ever use antibiotics for H. pylori. I don't find it to be necessary. Mastic gum is a great thing. There are a lot of herbal formulas that mix all these things together. Zinc carnosine, and then aloe, slippery elm, and licorice are often found in tablets and different herbal formulas. They're healing to the mucosa that's been damaged by H. pylori. So it helps prevent recurrence. And also, if there is burning, these things are cooling and calming to that irritated tissue. I have some of my favorite formulas I can share with you all at the end if you want. Bacteria, so again, if we're talking about SIBO particularly, most of SIBO overgrowth happens in that little area at the very end of the small intestine. So the key is if you're going to eat, the sort of strange thing about the SIBO diet is you can have more fruit and sugary things on this diet that you wouldn't suspect, like bananas, sweet fruits like mangoes, which are completely contraindicated in yeast. But the reason for that is they're absorbed very quickly in the small intestine, and they simply don't get to where these bacteria live, which is at the very, very end of that 20-foot long tube. So this diet particularly is a little bit different than the others. If any of you have looked at this online, I'm sure you've seen low FODMAP. That has to do with fermentable fibers, and that's why I added in low fiber. Really high fiber containing foods like whole grains, brown rice and such, quinoa, those things are often very irritating. Raw foods like salads, very irritating to SIBO because all of that fiber gets down to where the bugs live. They eat the fiber, do their bodily process, and produce either methane or hydrogen gas, which is what's responsible for the bloat and the pain. And the only thing that helps that bloating is time. It just has to be reabsorbed into the system. And then GF and DF is gluten-free and dairy-free. Gluten and dairy are irritating to an irritated system. So pretty much if you've got gut irritation, even if you don't have a gluten allergy and you're not inherently in your blood allergic to dairy, they are irritating to the lining of the gut itself. And there's often at least a period of time where those things maybe need to be removed for just about everybody. But depending on the person, you can add them back in once things are healed up. And then I put minimal fruit on here because, again, there are some fruits that you can have on this diet. And I have a handout. If anyone's interested in these diets more specifically, I have handouts that I use that I can share with you. The treatment for this is rifaximin or Xifaxan. It's one of the handful of antibiotics out there that I think are great and super useful. My thought on this drug, and this is purely my thought, I don't think it has any scientific basis, that rifaximin tends to treat gram-negative bacteria very well. If there's a recent history of food poisoning, it works super well. It works great for C. diff, which is a bacteria that can overgrow when people's guts are really out of balance, especially if you've been in the hospital. But it often requires at least 2 rounds of treatment, and there's almost always relapse. So I tend to use it, but then I'll use other things either in combo or immediately after to make sure we get it all. There are a lot of herbal formulas for SIBO that I use pretty regularly, and they work just as well. They've been studied. They work just as well as rifaximin for a fraction of the cost. A 2-week supply of rifaximin can cost in Marin County and upwards of $2,500. And then there are different herbs and different formulas for gram-negative and gram-positive I mentioned before. And rarely do I see purely SIBO with no yeast, no parasites, nothing else. It does happen. And when it does, it's so great because it's pretty easy to fix. But it seems to be a rarity these days. Yeast and fungus, I think, are highly underdiagnosed. I mentioned last week that, Candida was all the rage in the 90s and everybody had Candida overgrowth, and they probably did. But I think we still do. With our stress level, alcohol and caffeine consumption, antibiotic use, all those things predispose us to yeast overgrowth because yeast already exists in our gut. It doesn't have to be introduced like a parasite. It simply has to be given more room to grow. And lots of things we do in our lives make that possible. So this is the one that you need really low to no sugar, no alcohol, low carbohydrates, gluten-free, dairy-free. And in this case, you can eat higher fiber because fiber acts like a scraper. It kind of scrapes things off the wall of the intestine. So there are particular types of fiber and binders that can be really useful with yeast. Treatment, it takes time, just like with parasites. Yeast can be very tenacious and can take 2 to 3 months to really get rid of, uh, which is nothing in comparison to how long sometimes people have been struggling with symptoms. Nystatin is the prescription drug that I use most often. I don't use any of the azoles. They have too many side effects like ketoconazole or fluconazole. Nystatin's an old drug. It's localized to the gut, just like rifaximin. So they're both drugs that stay in the lumen, the interior of the small intestine. They're not absorbed into your bloodstream. So they don't have extra body effects. And nystatin is just a fungal killer. It doesn't really kill other stuff. It works pretty well. It can cause a lot of die-off. If people have got hefty overgrowth, you have to start slow, low dose, and move up, because yeast die-off is no joke. The side effects can be really, really awful and painful. Caprylic and undecilinic acid are things that you might commonly see in formulas like at Whole Foods. Super useful for yeast. I often use them in combination with pharmaceuticals. There is one product on here I didn't add, but there's a pharmacy in Colorado called Belmar Pharmacy that makes a product called Oil Blend Tablets. And it's a bunch of essential oils bound to a tablet in a particular way that carries them into the small intestine intact. And it is a miracle. It's an amazing product for yeast and for parasites. And then, as I mentioned, both parasites and yeast hide behind biofilms, so you have to get rid of those biofilms using things like N-acetylcysteine, monolaurin. We use a product called aqualaurin here in the office. Different herbs are biofilm disruptors. Essential oils of all kinds are biofilm disruptors. So that's a big part of chronic treatment. And then, like I mentioned, it just takes time. Yeast treatment, people really need to be patient, but the benefits are usually pretty amazing within about a month, 2 weeks to 4 weeks. And then parasites, again, low sugar, carb, and alcohol, although not maybe quite as restrictive as with yeast. Yeast feeds off sugar better than anything else. That hence the alcohol intolerance that most people have. The diet will vary per parasite to some degree. There's often a lot of inflammation and immune system depletion from parasites, and so you often don't make a lot of lactase enzymes, so digesting dairy can be tough. So again, gluten-free and dairy-free. Quantity of food matters here, like what you're eating, and that's often a telltale sign. People can't eat big meals. They don't feel hungry ever. Their appetite's really low. That can also be yeast. And in certain parasites, particularly liver flukes, fats can really bother people. Any kind of fat, but particularly greasy food, anything that stimulates the gallbladder and the liver. Treatments, this is one area where I do utilize pharmaceuticals pretty regularly, and there's a whole host of them. Parasites are hard to kill with herbs alone. I've never seen it done with only herbs. It might if you did it for a year. I don't personally have the patience for that, but some people might want to do that, and that's fine. I use them in combo. I use pharmaceuticals and herbs together, and these are some of the herbs that I really like. Mimosa pudica is a seed, the perilla seed, and it swells when you ingest it and becomes this really great scraper, scrapes things off of the intestine wall. It's an Ayurvedic herb, and as is Vedanga and neem. A lot of the Ayurvedic herbs are great for parasites. Parasite treatment takes time because of the life cycle. So again, I would settle in for at least 3 to 6 months with parasites, finding a treatment that someone can tolerate, and then just doing it in regular intervals over a course of time. And I do change the herbs up and rotate formulas just to kind of attack them from every angle. So I know this is a lot and I'm probably over time, just a little bit, but some highlights to remember from today, because we did talk about a lot, is that this is a whole body issue. Gut imbalance does not just mean intestinal symptoms. And I will add one thing I didn't say is that sometimes people don't have a lot of gut symptoms. You know, they have bowel movements every day, although maybe they're slightly variable or a little too soft or a little too hard, but nothing overt. They don't feel like they have a gut issue. But when we really start to delve into the details, there are some signs of imbalance. But the main symptom for some people might be somewhere else in the body, just intractable insomnia or joint pain. That's a thing I didn't mention, but with Yeast and parasites, joint pain can be part of it, even as far as to be diagnosed with rheumatoid arthritis. So don't rule out doing a stool test or rule out a gut imbalance just because you're not having a ton of GI symptoms proper. Um, Heartburn, just another heartburn reflux reminder that it can be silent. It's a sign of deeper imbalance. Often, in my experience, that is yeast and parasites, but not always. It can come along with SIBO as well. It's also really common. I should mention that if I were to just poll my patients randomly, I'd say that of the prescription medications that people are on most commonly, thyroid medication, heartburn medication, beta blockers, and statins for cholesterol are probably, in the top group of them. And it is hard to get people off of heartburn medication. It is something that I would not suggest trying to do on your own unless you enjoy pain. You will always get rebound heartburn because you've been stopping those acid pumps. And the minute you take that cover off, they're going to flare up and the symptoms are going to be worse for a period of time. And so you want to mitigate that while balancing the system and dealing with that deeper imbalance. But it can be done, I promise. Yeast and mold can look very similar. They can colonize together. They can both be part of the problem. If you suspect mold and you have sinus symptoms as well, have your house tested, do a mycotoxin test, but don't forget that yeast is also a mycotoxin and that could be part of the problem. I've had quite a few patients lately who have been diagnosed with mycotoxins on urine test, but had never looked at yeast, and the yeast overgrowth was preventing them from fully eradicating the mold in their body. Parasites are extremely common. They can live in your body indefinitely. So if you got them when you were 20, you never treat them, they'll be there when you die. They can cause so many systemic symptoms, and they have to be treated to get rid of. They won't just ever go back into balance. Like sometimes bacterial imbalances can be corrected over long periods of time with diet changes and probiotics and whatnot. Parasites cannot. They have to be treated. Testing. Stool tests aren't perfect, but they are helpful if you have someone who can read them for you and give you the information you need. And you can even learn a lot from just looking back at your basic blood work. Having someone with a trained eye look at all those parameters of red and white blood cells can give you a tiny little snapshot into gut function. And then treatment, obviously, you want to treat an imbalance because of this whole body systemic effects, but it's complex and multifaceted. There's no single treatment or perfect treatment for everyone. It really needs to be individualized to the person. And because testing isn't perfect, there always has to be a combination of clinical symptoms, history, and treatment results. You kind of have to look at all of them and decide where to start. So coming up next week, this leads us to our next and final topic in the series of to cleanse or not to cleanse. Based on all the information we talked about last week, how the system functions when it's healthy, how it doesn't function well when it's out of balance, all of that information we're going to talk about next week will allow you to decide if you think cleansing is even a good idea for you. It's not always the right thing for people to do at any given time. And not every cleanse is right for every person. So next week, we're going to talk about cleansing versus fasting, different cleansing options that are out there. And if you have questions about particular cleanses that you've done or some friends suggested, please bring those for next week and we'll talk about them. There are lots of options. There are lots of ways to rest the digestive system, which is really what this is about. So based on your particular circumstance and your symptoms or not, which cleanse should you choose? How long should you do it? How to reintroduce things when the cleanse is over is a big part of it. And then should you even do it right now or not? Or should cleansing be left for later? So it'll be another big week next week, but that's what we will cover. So that is it for today, and I think I went a little bit over time, but I think you all have my email because you got a link, but if you don't, there it is, and feel free to email me with questions. I'm gonna stop this